This video is dedicated to the finest therapist, Dr. Winore. The therapist's role is to help the client identify and utilize their own resources and strengths to find solutions to their problems. The model emphasizes on the client's resources and strengths instead of problems and deficits. The model is highly flexible, and can be adapted to suit the unique needs of each individual client. Unlike traditional psychoanalytic therapies, which focus on exploring the client's past experiences, the MRI Brief Therapy model focuses on the present and the future. The therapist works with the client to identify and achieve specific, concrete goals, rather than focusing on long-term changes or deep-seated psychological issues. The model have a problem-solving and goal-oriented approach, focus on understanding the client's problem and what they would like to achieve. The therapist also emphasizes on the client's strengths and resources, and helps the client to set specific, measurable goals that are in line with their values and aspirations. The therapist and client work together to develop a plan of action to achieve these goals, and the therapist provides support and guidance throughout the process. MRI Brief Therapy is often used to treat a wide range of mental health problems, including depression, anxiety, stress, and relationship problems, among others. It's a flexible therapy that could be easily integrated with other therapy models and has been used in various settings, including couples, families, and groups as well. Some questions that a therapist might ask a client during an MRI Brief Therapy session include: what is the problem that you would like to work on? What would your life look like if this problem were resolved? What have you done in the past to try to solve this problem? What are some things you are doing now that help you cope with this problem? What are your goals for therapy? What are your personal strengths and resources that you can use to achieve your goals? What are the first steps that you can take towards achieving your goals? How can I support you in your efforts to reach your goals? How will you know when you have achieved your goals? What do you think would happen if we did not address this problem? The therapist also encourages the client to focus on the present and the future, and to identify specific, measurable goals that align with their values and aspirations. The therapist may also ask questions that help the client to explore their thoughts, feelings, and behaviors related to their problem. It is important to note that these questions are not meant to be asked in a rigid, sequential manner. Rather, the therapist will use their discretion and clinical judgment to adapt the questions based on the client's needs and the specific circumstances of their case.